Virginia, Mr. Griffith, for your 5 minutes of questions.
Thank you, Madam Chair. Can you hear me?
Yes.
All right, I appreciate it. I have submitted for the record a letter from Jennifer Feist. Many of you likely heard about Jennifer's sister, Dr. Lorna Breen, head of the emergency department at Columbia Presbyterian's Allen Hospital in New York City. Dr. Breen endured weeks of extreme stress as she worked around the clock to help COVID-19 patients and also battled the virus herself. Eventually, the responsibility for human life, lack of sleep, and unknowns of this virus became so burdensome that Dr. Breen became physically unable to continue and sought help for a weakened mental state. She told her family that as a result, she believed her license to practice medicine was at risk and her career could be over. Approximately 2 weeks later, she took her own life. The bills before us today address many important issues, but none would have alleviated Dr. Breen's concerns. We must consider the mental health of the providers on the front lines of a pandemic. I dare say very few individuals could have endured the struggles Dr. Breen faced without help. Now, I know somebody talked about it earlier, but I was on my way over to vote. I was listening, even though I was going over to vote. But for Dr. Evans and or Dr. Geller, do you believe doctors should be able to seek help from mental health professionals without fear of losing licensure?
So I spoke about that earlier, and I'm quite familiar with the Dr. Breen case. And the answer to that question is absolutely. One of the questions is, should states even be able to ask the question on your license application? And most states, in fact, ask the question. We have got to start a major campaign to address prejudice and discrimination. You know, we use the word stigma, but I think it's actually an unfortunate word. If we use the word prejudice and discrimination, we would understand that it's the same prejudice and discrimination against minorities. It is prejudice and discrimination to think that if a person has a mental illness, they're not capable of functioning. We have a panel member right here, Patrick Kennedy, who addresses that throughout his life. And he is actually one of millions of examples. We have clubhouses that help people go back to work. We have all sorts of interventions. And I mentioned in my introductory remarks, I have a son with pretty significant intellectual disabilities who keeps people alive every day in his job by delivering medical supplies that are necessary to the functioning of that hospital. So yes, emphatically, we need help from Congress to remove prejudice and discrimination and treat it just like all other forms of prejudice and discrimination.
Congressman, if I could add something?
Absolutely, yes, sir.
Your point is a really good one, and one of the big challenges of the way we deal with mental health in this country, and Patrick references, it is almost entirely reactive, and we wait for people to have a diagnosis before we intervene. One of the things that we have to start doing is start working upstream, start providing services to people before they need, before they're in crisis, before they have a diagnosis. One of the things that the American Psychological Association is doing is developing information, and that, in fact, for healthcare workers is one of the groups that's based on psychological science that tells people how they can help to manage and mitigate their stress and to do self-care that will reduce the likelihood that their psychological distress is going to lead to the
one more quick question before I run out of time. I represent a large rural district where access to every kind of care is often limited, and as much as we might like to have psychiatrists everywhere, we just don't have them. Do you believe H.R. 945 would help rural communities?
Absolutely. I can tell you that I spent a good amount of time last year in a southern state, and the major reason that people miss their follow-up appointments is they don't have money to put gas in the car. And the other is, one of the reasons that we have affected attendance at follow-up visits is that it's the doctor who initiates the contact. So I can tell you my own experience. I've had lots of telepsychiatry contacts where the person said, "Oh, I forgot about my appointment." Well, lo and behold, we had the appointment anyway because I contacted them. So yes, it can make a huge difference in rural areas.
Well, the telemedicine certainly can, but I'm also talking about expanding the ability of a number of people to be able to provide some help who aren't currently licensed to do so.
I think that that's important. One of the things that's happening in global mental health is the notion of task shifting. Not all of the functions that mental health professionals do necessarily need to be done by a highly trained mental health professional, and many of those things can be other people can be trained to do. In addition to that, peer support is extremely important, and both in terms of engaging people who would otherwise not be engaged, keeping people retained in treatment, and otherwise supporting people in long-term recovery. So it absolutely is something that's important, another important element to a well-rounded mental health system.
Thank you very much. I yield back.
The gentleman yields back. It's a pleasure to recognize